Welcome to Part 3 of Advanced Care Planning, Completing and Sharing Your Plan. This information was originally developed by Carly Olson, DNP, with attribution to Nancy Joyner, a palliative care clinical nurse specialist, and has been adapted to a Synthesia AI presentation. Advanced Care Planning North Dakota, or ACP will be referenced throughout this presentation. This organization, formerly known as Honoring Choices North Dakota, was developed in June of 2013 as a statewide initiative to improve advanced care planning across the state. The governing board is comprised of a multidisciplinary group of individuals from various professions and organizations across the state of North Dakota. The overarching goal of ACP is to educate community members on developing a successful advanced care planning process. This is Session 3 in a three-part series. Session 1 was an introduction to advanced care planning and was aimed at gaining a better understanding of the advanced care planning process, gaining an understanding of various legal documents, and identification of various medical terms that are associated with advanced care planning. Session 2 explored personal values, beliefs, and medical preferences, as well as identification of a healthcare agent. This is Part 3. In this video, we will encourage you to complete an advance directive and share your wishes with your provider and your loved ones. The second session of this series shared ideas of how to have necessary conversations about advanced care planning and how important it is to complete plans prior to a crisis. Next, you need to share your plan with your loved ones and medical provider. For this project, we are using the ACP Advanced Directive Forms, available in two versions on our website at www.acpnd.org. The short form is for healthy adults ages 18 to 40, and the long form is more detailed and covers areas such as choosing a healthcare agent, specific treatment preferences including CPR, organ donation, and autopsy decisions. The long form also has an optional section, My Hopes and Wishes, on page 7. You don't have to complete every section. However, remember the following three things. 1. Once you have completed an advance directive, you need to make it legal. The form must be notarized or signed by 2 witnesses. 2. It only takes effect if you lose the ability to make decisions, unless stated otherwise. 3. In North Dakota, your healthcare agent must accept the role by signing on page 9, and they can withdraw at any time, so it is important to choose someone that understands your wishes and their role. A crucial but often forgotten step in advanced care planning is making your directive accessible. Simply completing and notarizing it isn't enough. If no one knows it exists or where to find it, your wishes may not be followed. Avoid locking it away in a safe deposit box. It cannot be stressed enough that you need to keep the original copy at your home, preferably in an easy access location. The next thing that you can do is provide a copy to your doctor or primary care provider. You could simply take a copy to your next visit, and they can scan the document into their system and have it on file. It is also a good idea to have an advanced care planning conversation with your healthcare agent, and to also provide him or her with a copy of your advance directive. If you have family members who play a pivotal role in your healthcare, consider giving them a copy of your advance directive as well. Lastly, consider giving a copy to your attorney to keep with any other legal documents. These are all suggestions, but the one that should be emphasized the most is giving your healthcare team a copy of your advance directive to help guide your care in a medical emergency. You should periodically reassess your advance directive. This is commonly done at these benchmarks in life called the 6 Ds. You reach a new decade in age. You experience the death of a loved one. You get a divorce. You receive a diagnosis of a significant health condition. You experience a significant decline in your functional condition. And finally, you change your domicile, which is where you live, or if someone moves in with you. Even though you have an advance directive in your medical record, you may be asked about it again, especially when you're admitted to the hospital. There are various reasons for this, which are listed on the slide, but most importantly, we want to assure that the care that you receive is still aligned with your values and preferences, and that nothing has changed since you last signed your advance directive. If you completed an advance directive several years ago, maybe it is time to revisit the document to ensure that your wishes haven't changed. Sharing your advance directive with your provider, healthcare agent, and family is essential, especially in rural areas where transfers to larger hospitals may not align with your preferences. Your emergency contact, if also your healthcare agent, can ensure your wishes are followed, including refusing certain treatments like intubation. North Dakota law designates decision makers if you're unable to, but having a documented plan prevents delays and ensures your choices are respected. Ultimately, your care decisions are yours, and you have the right to decline treatment. In the recent pandemic, many patients required extensive life-saving treatments. At the beginning of the pandemic, there was a new sense of urgency to partake in advanced care planning and complete an advance directive. Many organizations and healthcare providers across the country encouraged patients and their families to reassess their advance directives, if they had one in place, or to develop one to ensure that their preferences for medical treatment and end-of-life care were documented. Research found that the number of completed advance directives drastically increased in the first 3 months of the pandemic, but that number has slowly plateaued in recent months. Despite the controversy surrounding COVID-19, the pandemic provided an opportunity for patients to discuss goals of care and preferred medical treatments with their healthcare teams. ACP has designed wallet cards explaining that you have an advance directive and denoting who to contact if you are unable to speak. In the event of an emergency or an accident, healthcare providers and emergency responders will search your wallet for a form of identification or any other important information, such as this. As with the advance directive, the wallet card is also available on the ACP website. Thank you for joining us for Part 3 of Advanced Care Planning. Reminder that further information can be found in the other parts of this series. Part 1, Introduction to Advanced Care Planning and Definitions. Part 2, What Matters? Reflecting on your personal values, beliefs, and medical preferences. You can also find us on our website at www.acpnd.org,